Hi and welcome back to Talk Therapy channel on YouTube. I'm Tammy Fletcher, licensed marriage and family therapist, and today we'll be answering some frequently asked questions about dermatillomania. My first video about dermatillomania was made in March of 2012, and it is far and above my most watched and commented upon video that I've ever produced. I hear from viewers several times a week about dermatillomania and that first video, and I will link that down below. And they've provided me with some great questions for a follow-up video, so I'll be taking the most frequently asked questions that I've received about dermatillomania and answering them in this video. So let's go right ahead and get started with viewer questions. The first one is, what is dermatillomania? Now, we know that it's a skin-picking disorder. We know that it's now also called excoriation as of the publication of the new DSM-5. That's the Diagnostic and Statistical Manual that therapists and mental health professionals use to diagnose their clients and patients. We know what dermatillomania is, but when people ask me this question, typically what they mean is it the same as obsessive compulsive disorder? Is it a type of anxiety? Is it just a bad habit? So let me first answer that by referring back to the new DSM-5, which has for the first time included dermatillomania in its list of diagnostic codes. They call it excoriation, and they have a list of criteria that must be met, just like any other diagnosis. They do list it under the section on obsessive compulsive disorders. Now, in my experience in seeing many clients with dermatillomania, are they all diagnosed also with OCD? No, they definitely are not. There is not one specific type of person who picks at their skin. Some of them do have OCD. Some may have ADHD, attention deficit and hyperactivity disorder. Some have anxiety. Some began picking when they were younger, maybe in response to coping with some stress in their lives, or perhaps it's as simple as when they started to break out when they were a young teenager, they began skin picking. So I can't lump all people with dermatillomania under the category of obsessive compulsive disorder because it just doesn't fit. But at the same time, I'm glad to see it was included in the book, and I think it's a start in getting recognition for this very common disorder. But speaking of diagnosis, for me, the why behind the skin picking is important, and we work on that, why it's happening, where it started. But we focus just a bit more on the role that skin picking plays in the person's life in present time, in the here and now. Now, the second common question, it's not really a question, it's more of sort of a statement, people sharing their stories, but it comes up very often, is when they say to me, my friends, my family, my significant other, or all of the above, don't understand my skin picking. They may criticize me, they may feel like they need to monitor my skin picking, and it's clearly upsetting to them. Now, they may be just trying to help. They may be watching for signs of picking or catching you picking and saying, stop that. Or they may say things like, I just don't understand this. Why can't you just stop? Now, chances are none of the above are very helpful for a person who picks their skin. Occasionally I will meet someone who says, I have asked my close friends and family if they see me picking to just sort of give me a gentle reminder and say, you're doing it. That primarily will help someone who picks and they're not aware of it. They're just maybe watching TV and they'll start picking their skin. And they will ask for that type of reminder from someone in their inner circle to let them know so that they can become aware, bring it into their consciousness, and stop. The key there, though, is that they are asking for people to remind them, as opposed to people who probably mean very well and they want to help, but reminding the person or catching them or noticing their face or mentioning it a lot may not be the most helpful thing that a person with dermatillomania experiences. In most cases, the person who picks at their skin is very aware that they're doing it, and there's a degree of embarrassment that comes along with it. It's not helpful to feel monitored because they're already feeling a degree of shame about it, especially if criticism or judgment is expressed to the person. That can actually make the situation worse. So what I suggest to my clients is that they sit down and have an honest conversation with the people that care about them, because chances are their behaviors, which are not so helpful, have good intentions. So sit down with your loved ones, with your friends, and tell them what you know about your skin picking disorder. Offer them some resources if they'd like to read them. Let them watch this video if you think it would help. Help them understand, because as you probably already know, if you're a person with dermatillomania, there is a lack of understanding generally in our communities. So if you can educate those around you, tell them what you need, tell them what is helpful to you as you begin to reduce and stop picking your skin, then they can be part of your team during your recovery. Okay, the next question is one that I've received several times, and it's a really good question. How can I find a doctor who understands dermatillomania? Now, as a marriage and family therapist, I sometimes work with doctors on a variety of client issues, if it will be of benefit to my client or patient. Dermatologists are the type of physician who deal with treating disorders of the skin. Chances are when someone has dermatillomania, before they come to me to get treatment for the behavioral side of skin picking, they've probably seen at least one dermatologist. Dermatologists are not the only doctors who may treat dermatillomania. Others might be primary care physicians or even psychiatrists. So if you are seeing a physician for any reason, including skin picking, I strongly recommend that you do some preparation if you can before the visit. For example, if you're going to see a dermatologist, you can, at the time that you call to make the appointment, you can ask if this particular doctor treats dermatillomania, or they may call it excoriation, which is the term used in the DSM-5. There are some doctors who may be much more familiar with dermatillomania than others, even though they're both dermatologists. And the last thing you want to experience is to go to a doctor's office and be asked, why can't you just stop? You want to find a doctor who can take the time to listen to you, who understands both the physical and the psychological aspects of skin picking, and who can answer any questions that you might have. Ideally, you find a doctor who is open to discussing all the different treatment options that are available to you with you. Now, as a therapist, I have the luxury of spending an hour with each one of my clients, and doctors don't always have that kind of time available. So one thing that you can do to make it easier and to keep good communication with your doctor during that time that you have your appointment is to jot down some notes before you go. You're undoubtedly going to be asked for a history of what you've experienced with dermatillomania, so you can remember when it started, how long it's been going on, where you typically pick, what you think the cause might be, and be ready to share that with the doctor. You can also, and I strongly recommend this, anytime you see any doctor, is to write down any questions that you have. It's very common to leave the doctor's office and go, oh, I forgot to ask about this one thing, or the side effect of this medication, or things like that. So make sure you write down any questions and whip out your list and go through it with the doctor. I don't know too many physicians who discourage that. I think they appreciate a little bit of preparation on your side. Now, I can tell you that I live in a big city with a lot of dermatologists, and even I have a difficult time sometimes finding a dermatologist who really understands the big picture of dermatillomania. One I have been blessed to work with is Dr. Sabrina Fabi, and I'm going to link some information about Dr. Fabi down in the down bar, and you can check that out. She's a cosmetic dermatologist, an MD, who does all kinds of different treatments for different problems, but she really has a handle on dermatillomania. I've had her come to my office and speak to a skin picking support group, and the look of relief on their faces sitting and listening to a medical doctor who really gets it was amazing. I know she can't be the only doctor in my city or state or around the world. So if you're an MD watching this and you treat dermatillomania, please let me know. Share your name with me, or if you have a wonderful doctor who understands skin picking and has helped you, please message me or leave the information in the down bar. I really appreciate being able to expand my network for referrals. I've received many more questions than this, but this video is probably getting painfully long to watch, so let me close with this one, and that is there hope I can ever stop picking? The answer to that is yes. I can't say dermatillomania is easy to overcome, but there are a variety of tools out there that you can use to help you on your path to recovery. Everything from meditation to exercise to diet, getting enough sleep, cognitive behavioral therapy, everything all the way to the other end of the spectrum, including medication. So don't give up hope. There is help out there, and many, many people have reduced or stopped picking their skin. I don't know what your particular path is going to look like, but I do know it's out there, and that there are professionals hopefully increasing all the time as we continue to provide continuing education and raise awareness for body-focused repetitive behaviors like dermatillomania and trichotillomania. So definitely don't give up. Keep looking for people to add to your team as you work toward wellness, and I appreciate your time in watching this video. Thanks so much, and I'll see you next time.